Guys, in this video, let us look at how to read forensic science, forensic medicine, toxicology. In the previous videos, we have covered which books to read and what exactly the syllabus is. So now here it's a generic video to tell you how to read this subject, how to approach it, how to pass. Okay. So first of all, get the question bank from your university, right? The previous question papers of previous years, etc. And look at the important questions. You look at the priority questions. You should not read everything. If it's been asked once, maybe you can ignore it. If it's been asked 5 to 6 times, read those questions a lot, okay? So, forensic medicine is very easy in terms of the flow, right? If you know what it is, right, it is day-to-day life. You need to know some terms like, let us say, there is a term in, let us say, let's pick up a term, wait. Exhumation. Like this exhumation, right? You should know what it is. Then only you'll be able to write. So specific terms as questions, those terms you should read. Because if somebody asks you, what is medico-legal autopsy, significance, all that you can write, you can build up, but you should know what it is. Some specific terms will be there in forensic medicine, like, wait, we'll give you a better example. Like vaginismus. I had absolutely no idea what it is. Right, I could think something to do with the vagina, but you should know exactly what it is. So if you know what it is, you can elaborate on it and cook up and do a lot of things. But specific terms you should know, like what is vicarious liability? It's some type of liability. Actually, this one you can guess, right? Like the CEO is responsible for all his employees' actions. What is loco parentis? Loco is movement and parent is parent. So a moving parent, like a teacher. So that is what these actually you can guess. There are some things which you really can't guess. Wait. Res judicata. Actually, res judicata, you can still know it's something to do with judiciary. Well, anyways, so these are some terms that they just give in the exam and they ask you to write about it and you will have no idea what it is. So, specific terms you learn, okay? Don't leave any term that you see in forensic science. That term, even in some chapter, some paragraph, somewhere it's coming, the term you remember. Because the term itself can become question. Okay. Then, so that is about forensic medicine. In toxicology, you have all the poisons, right? So, most of the poisons keep on overlapping. You kind of write the symptoms of this poison there and that poison here. So, learn only the unique things about each poison, okay? At least know the classification, like cardiac poisons, what are the cardiac poisons? Like 4 or 5 cardiac poisons are there. What is spinal poison, like strychnine? You should know specific poison examples, okay? The classification. Treatment for all these poisons will almost be the same, okay? Now coming to practicals, you should know that you can have spotters, they will give you x-rays for age estimation, right? Then how to examine rape victim, how to examine a rape survivor, okay, you should not use the word victim. Then certificates, right? Certificates, wound certificate, physical fitness certificate, all those certificates how to write. Usually, when they give you a history, in that itself all the information will be there. You just have to write the certificate. You'll have to know that for every certificate you will have to write identification marks. Identification marks you have to write 2 identification marks. And how to write an identification mark? Let us tell you how to write an identification mark. Like identification mark will be something like this. Wait. You will have to say brown 1 centimeter by 1 centimeter or mole, let us say mole on left arm, okay, on left arm near elbow. Something like this. A bony landmark, the location, the dimension, the color, whether it is a birthmark or what you think it is. Right, so this will be 1 identification mark. Something like that, you have to write another identification mark. 2 identification marks for everything. Drunkenness certificate, etc. So remember that you will have the case given to you already. So remember those cases and you have to write for the same cases. Okay. Then bones, you will have to know how to differentiate a male and a female. Right, it is not very difficult. Skull also. If you are wrong also, it is fine. But you should know the features. Like for whom is it prominent, for whom what is prominent, right? At least that part if you know, even if you make it wrong, it's fine. Because sometimes you cannot say it so accurately, but you will say, I feel that this could be a male skull. Coming to Viva, basically Viva, they can ask you the entire syllabus, and they like to ask sections. They like to ask the age in the sense, what is the importance of age 12, what is the importance of age 14, what the importance of age 16 is, etc. So the specific things they like to ask like that, okay. Another favorite question in our Viva was the saltwater drowning versus the freshwater drowning. So revise that one also, okay. So that's all about how to read forensic science, guys. So hope you enjoy forensic science, reading it. You will pass, just focus on whatever we told you, okay. That's all for now. Bye-bye.